watching Delivering Joy MD, brought to you by me, Dr. Joy. I'm an OBGYN and I developed this channel to talk about all things woman. So you definitely want to click that subscribe button and become part of my girl gang. So today I'm going to be talking about something that I think is very basic but majorly important. I get so many questions from women all the time about what's down there. It's like this big mystery, and I find that women sometimes feel really uncomfortable talking about their female reproductive organs, especially the vagina. So I've heard the vagina called everything from Virginia to pocketbook to, I don't know, kitty cats, all kinds of things. But today I'm going to teach you the real terms to describe your lady parts, and I'm also going to break everything down for you so it shall forever and consistently be broke. So the mystery down there, I really recommend that every woman take an opportunity to get in a private location, get your mirror, and take a look down there. We really want to know what's happening down there. And I find that a lot of times people are not really getting great education because maybe our moms didn't get great education. So we want to break down a few terms today and really kind of understand what's happening down there. So the female reproductive tract is really like super amazing. God created us to do some pretty awesome things, and I really want you to have a feel for what's going on. So let's take a look at this picture below of the vaginal area. This is what we call the vulva. The vulva is the outside part of your vagina. It's the part that's usually the same skin color as you are. And the vulva is kind of like the opening to the vagina. So you have the labia majora, which are the larger lips that surround the vagina. You have the labia minora, which are the smaller lips that kind of line the what's called the vestibule, or like the opening of the vagina. And then of course directly under the labia minora is everybody's fun button, the clitoris. And so that's like probably the most important thing down there, the most important working equipment that you got. And then below the clitoris is the urethra. The urethra is actually the hole that urine comes out of. So this is where, you might have pain if you had a urinary tract infection, for instance. Below the urethra is the vagina, and the vaginal opening, of course, is where babies come from, where sex happens, and also where your menstrual cycle comes from. And then right below the vagina is the anus, and the anus is your hole that you poop out of, right? So we're gonna kind of break these things down in terms of the hookups. So these three openings that you have in the vaginal area, the urethra, the vagina, and the anus, are not connected in any way, except that the openings are in close proximity to each other. So the urethra is what we'll start with first. The urethra actually is connected to the bladder. And so the bladder, of course, holds your urine. The bladder is connected to the kidneys by two tubes that run almost from your abdomen way down into your pelvis, and these two tubes are called the ureter. So you have the urethra, the bladder, the ureters that are connected to the kidneys, and this is considered your urinary tract. So the kidneys make the urine because they're always filtering your blood, and then they shoot that urine down through the urethra.
Oops, I meant ureters.
And then when you go to the bathroom, the bladder opens into the urethra, and the urethra lets you let the pee into the toilet. So that is your urinary tract. And so of course you could have infections anywhere along that tract. So the kidneys could become infected, the urethra could be infected or inflamed, the bladder could be infected or inflamed. And so what we normally see is with urinary tract infections, you'll find that there was some bacteria that came from the vagina that got
Or from the anus that got into the urethra.
And traveled up into the bladder and even sometimes up into the kidneys. And so those urinary tract infections might have symptoms like bleeding with urination, pain with urination, just lower abdominal pain, back pain as well, because the kidneys are located in the back, like in the flanks here. So those are the types of things you're thinking about with urinary tract infections. So let's move to the vaginal tract. So the vaginal tract is really what contains what we call the female reproductive organs. And so you have, of course, the opening to the vagina, and that opening is called the introitus, basically like intro. So the introitus is the area where the hymenal ring is. And the hymenal ring is what people talk about when they're like, can you check the hymenal ring? Like, T.I. was saying he was taking his daughter to get her hymenal ring checked to make sure that it hadn't been broken. So that's kind of like the thing that we talk about when we think about women's virginity. Now, the hymenal ring can be broken by doing just about anything. Like if you fell off your bike when you were 10, you could have possibly broken the hymenal ring. So we don't really use that in GYN, and I was always really curious to know like who actually is doing those checks, because that's a little suspect. So we are at the entrance of the vagina, and you then can travel down the vagina to the cervix. Now the vagina is what we call a potential space, and so that means that if nothing's in there, then the vagina is pretty much closed. And so when like there's something coming out or going into it, it actually opens up, and it has these rugae that are inside of the vaginal tissues that allow the vagina to stretch. And that's how women can actually have babies from the vagina. This rugae is very important. There are also glands that produce moisture in the vagina, and that help to keep the vagina a normal pH. So the vagina has lots of bacteria that live in it that are like a little vaginal neighborhood. And so it's really important to keep those, to keep your neighborhood with the right balance. And by the right balance, we're talking about chemical balance, or pH. So at the back of the vagina, we find the cervix. And the cervix is kind of like the mouth of the womb or the uterus. And so the cervix actually goes right up into the uterus. And the cervix usually is, is what we're looking for when we're doing pelvic exams. So not only are we looking at the vagina and the rugae, but we're also looking for that cervix, and that's where pap smears come from. That's the opening that's dilating when a mom is in labor, and so that cervix goes directly up into the uterus. So we pay a lot of attention in OBGYN to the cervix. It's like one of our favorite, body parts. And then the uterus is where the baby actually lives. The uterus is also where your period comes from. And so the inside lining of the uterus is very highly specialized. It's made to help babies implant, so to help a pregnancy implant so that a baby can grow there. That lining also sheds off each month during your menstrual cycle. And so it's a really kind of complex dance that the uterus and the ovaries do. So speaking of ovaries, how do we get out to the ovaries? The fallopian tubes. So the uterus connects to the fallopian tubes, and then the fallopian tubes sort of just kind of hang right over the ovaries, like you see in this picture below. And so these are our female reproductive organs. And then you can also count the breasts in that, because the breasts are definitely a highly specialized organ to produce milk for our children. So we've got the vagina, the cervix, the uterus, the fallopian tubes, and the ovaries. And that all is linked together. The uterus kind of acts like a closed system in and of itself. So things like vaginal discharge and vaginal itching are usually going to be coming from either the uterus, cervix, or the vagina. So that's important to know. just below the vagina, we have what's called the perineal body. And this is really like a super muscular, stretchy area that allows the vagina to open up so that a baby can come through, that allows the vagina to open up for sex. So we really benefit a lot from that perineum being able to be stretched and close back again quickly. So that's an important part that we need to know of. And just below the perineal body is the anus. And so the anus is the hole that we have a bowel movement from. And the anus is also very muscular, and it can stretch open and close back quickly. And the anus is connected to the rectum. And the rectum is kind of like a little holding place for our stool. And the rectum connects to the colon, and the colon to the small intestines, and the small intestines connect to the stomach. And then the stomach connects to the esophagus, which is the tube that takes your food from your mouth to your stomach. So there's like a little passageway in there. And then after the esophagus comes the mouth. So basically, the anus is what we like to call in the South from the rooter to the tutor. So from the mouth to the anus is where our food gets digested and we are able to get rid of waste products. So we've got the urethra, the vagina, and the anus. These things are not connected and should never be. If you think you've got poop coming out of your vagina, that's a real problem. Or if you think urine is coming out of your vagina, that's a real problem. Those systems are definitely doing different things. They just all happen to open up at the same location, which is in the vagina, or the vagina, the area of the vagina, I guess we could say. So the important things to remember is that there is so much anatomy in that little small area that you kind of have to be on your guard with regards to how you take care of it, and keeping that vaginal neighborhood or chemical balance at the right pH is really important. So we're gonna have some future and further episodes on this because, I mean, hey, if we're talking about all things woman, we have to definitely do a great job describing the vagina. So tune in, make sure you subscribe, and we'll be back next video with some hygiene tips. Talk to you soon, girl gang.